So things we should remember about anti-migraine agents, like the 5-HT receptor agonists and the ergot alkaloids, is that these medications can cause cardiac issues, dizziness and drowsiness. People should wait to drive or do anything else to see how this med is going to affect them. Drug interactions can take place with other medications that constrict the blood vessels. MAOIs, which are monoamine oxidase inhibitors, these are particular drugs that we will be talking about for other CNS conditions, and they don't interact well with anything really, as we'll find out. SSRIs, which are certain kinds of antidepressants, and lithium can interact badly with anti-migraine agents. Some things to remember during the nursing process: you want to do a thorough assessment, you want to do a health history, find out what type of migraines the patient has, how long they've had them. They should describe what the migraine does to them. For a diagnosis, you want to identify what triggers these migraines. If it's something preventable, like certain kind of beverages or foods, they can avoid those to a certain extent. Find out what they've done in the past to relieve the headache. Planning: remember that an ergot alkaloid acts on the uterus, so they're dangerous for pregnant patients. Most of the ergots are dangerous at any point in pregnancy because they'll contract the uterus. Now remember that our prototype ergot drug, the dihydroergotamine, or DHE45, Migranal, is the only ergot that doesn't contract the uterus. However, it's not safe in early pregnancy either because it can cause birth defects. So if the person has to take it, it would be one they'd take later in pregnancy, not in the first 3 months. Implementation: what regimen does the patient follow? When do they sleep? When do they eat? What do they do in their leisure time? What could they do to improve their health all the way around? Remember that caffeine can speed up absorption, and that's the reason why caffeine is found in a lot of over-the-counter medications. Your Goody powders and your BC powders have usually aspirin, Tylenol, and caffeine, and that's because caffeine can make things absorb faster, plus caffeine has a mild vasoconstrictive action. Sometimes when you are behind in your caffeine, you'll get a headache, and usually drinking caffeine takes care of that really quickly by mildly vasoconstricting. And then evaluation: which drugs are helping the patient? Which drugs do they get some relief from? Remember patient teaching: tell them to take these medications at the onset of the attack, as soon as they know the attack is happening, and that will speed up the relief that they'll get. The next condition we're going to talk about is Parkinson's disease, and this is covered in your book. So on page 160, we see where we start talking about Parkinson's disease. This slide shows the signs and symptoms of a person who's got active Parkinson's disease and how you will see them walking and moving around. You see there is a rigidity to the way they hold themselves. Their head trembles. There will be a trembling of their extremities, usually when they're at rest. If they start doing purposeful movement, sometimes that trembling will be relieved temporarily. They will walk with their trunk tilting forward. They'll kind of lead with their head and chest. They do not have that arm swing that we associate with easy walking, and they usually will shuffle and take short steps for fear of falling. I read somewhere that people we will lose our natural arm swing about 10 years before Parkinson's is even diagnosed. So that can be one of the first signs. So to treat Parkinson's disease is thought to result from an imbalance in the two neurotransmitters, acetylcholine and dopamine. Remember that we have acetylcholine that stimulates the parasympathetic nervous system, We have dopamine, which is an inhibitory neurotransmitter in the adrenergic or sympathetic nervous system. And there needs to be a good balance between the two for easy movement. What happens is the brain just stops producing as much dopamine. It's not that they make too much acetylcholine. They have the same amount of acetylcholine, but the brain stops making as much dopamine, and so there becomes an imbalance. And you have a stiffness and a rigidity in the limbs and a trembling. So what we need to do is change the balance of neurotransmitters. We need to kind of cut down on the amount of acetylcholine and try to build up the amount of dopamine so they will balance each other out again. We also need, with these medications, to block the uptake of acetylcholine. When the brain takes up acetylcholine, it will use it, and then the person will have all the actions of acetylcholine without as much dopamine to balance it. So we want to keep the brain from using so much acetylcholine, and we need to boost up the functional levels of dopamine in the centers of our brain that control our voluntary movement. So we are not curing Parkinson's, unfortunately. We have not found a way to do that, but we can help to control the symptoms. When it comes to the medications for Parkinson's disease, we need to remember adverse reactions. They can cause cardiac dysrhythmias. They can cause muscle twitching and problems with the GI tract. And remember the side effects of the anticholinergic agents. We're going to have, they're going to mimic the sympathetic nervous system. By blocking cholinergic or parasympathetic actions, they're going to mimic the sympathetic nervous system. So we're going to get dilated pupils and blurred vision. We're going to get increased heart rate, increased blood pressure. It's going to cause constipation and urinary retention. So remember those anticholinergic side effects. When it comes to drug interactions, there are a lot of different drug interactions, and all we can do really is direct the patient to the product package insert and show them what drugs they're taking and what are going to interact. I encourage you to read pages 160 and 161 as we see the symptoms of Parkinson's disease. You'll see in the box we've got motor symptoms and non-motor symptoms, including changes in personality, hallucinations, sleep disturbances. So it's not just a disease of the physical, it's also a disease of the person's self and their personality.